Although Virginia has been gaining some ground in the battle against opioids, the epidemic is still costing the state billions of dollars. That is according to a study by Virginia Commonwealth University and the Virginia Department of Health. Ethan Krause is on your side breaking down the numbers.
Thanks, Regina. Now, according to the VCU Center on Society and Health, the total cost of the opioid epidemic in Virginia increased from $3.5 billion in 2021 to $5.2 billion in 2023. This was determined by looking at four major sectors across the state, those being childcare, criminal justice, healthcare, and lost labor, with the last accounting for around $3.41 billion lost in 2023.
The largest impact was seen in those lost labor costs, primarily from fatal overdoses. So it's really a lifetime of lost wages, potential future wages for families, as well as a lifetime of lost workforce productivities.
When looking at Hampton Roads, the total cost came out to be $786 million, or about $862 per person. Portsmouth and Norfolk had the 5th and 12th highest costs per person in the state.
So if we just look at the total cost in a rural Southwest county compared to a large city like Virginia Beach, it's kind of be apples to oranges. To kind of standardize that comparison, we just take the total cost and divide it by the total population to have a kind of standardized for populations.
We see the numbers about fatal overdoses, but it's hard to know what that really feels like at a community level. And so we wanted to have another way of kind of capturing what these ripple effects are for communities.
Those involved in the study went on to say that over 2,000 overdoses were reversed in Virginia in 2023. And that research-backed opioid care could save more lives and increase economic value in the Commonwealth.
So when we see people saving lives on the front line of this crisis, they're also ultimately creating economic value by enabling people to have more healthy years that they can give to their families, to their communities, to their employers.
To end the crisis, we need to scale up our support for all the life-saving work that's going on. And with these cost numbers, $5 billion, there's really no reason not to do it.
Now, if you'd like to view the study for yourself or look at VCU's opioid abatement toolkit, be sure to head to the links on this story on wavy.com.